Hello, everybody. Thank you and welcome back to my channel. I'm always happy and pleased when you come back onto my channel to watch what I put on my platform. It's educative information. We talk about the health sector, we talk about medicines, we talk about the pharma industry, and motherhood sometimes. And I think it's very interactive and engaging, and you should come back every time to find out what we put here. So if you haven't subscribed, please do, and please click on the notification bell so that you can get notified anytime we put out any video. I really appreciate the support. Please do watch my videos. If you like the content, please like it and please share it with people that you believe this will be helpful for. So today we're actually discussing the myth associated to breast cancer. And this is because some of my viewers have sent me private messages to mention that we should discuss breast cancer and the myth associated to it. As you can see, I'm wearing my pink ribbon. It's October, it's Pinktober. It is the month that we make a lot of awareness, or we talk about breast cancer. And not just October, other months we would pick up certain issues. Like I mentioned, this platform is for speaking about health-related issues, and we'll keep educating the public as and when the demand is there. So one of the first things that I was asked is breast cancer contagious? Meaning, would I get breast cancer if I touch a patient who has breast cancer, if I relate to somebody who has breast cancer? The answer is no, breast cancer is not contagious. So if somebody has breast cancer, you can go ahead and support them, you can go ahead and speak to them, you can give them the support that they need, the attention that they need, because breast cancer is not contagious. It cannot be transferred from one person to another person. Breast cancer or any other cancer is actually the abnormal multiplication of cells. So you have a cell in the breast area when it comes to breast cancer that is multiplying abnormally. It is dividing and it is growing abnormally, and that comes with certain changes that are not the usual, and that is breast cancer. It's an internal process usually, so meaning that the external of you seeing a sore or whatever it is cannot be transferred to another person just because you touched the person. That is the first myth that has been busted. The second one that I received that was very interesting was, is breast cancer sexually transmitted? No, breast cancer is not sexually transmitted. You cannot have breast cancer when you have sex with somebody who has had breast cancer. It's not something that moves along those lines. I'm sure with time we'll do some education when it comes to diseases that are sexually transmitted, but breast cancer is not one of them. And it'll be interesting to find any studies that are being done in that regard, especially when that myth came up. The third myth that I was asked is, if your parent has breast cancer, is it certain that you would also have breast cancer? So there are lots of research going on that has to do with the genes of whether parents who have breast cancer would have children who have breast cancer and the likes. So sometimes there are people that have family history of breast cancer, and there are some research that has shown that about 5 to 10% of people who genetically or have breast cancer in their families would be able to have breast cancer. So if your mom has this, that 5 to 10% chance of you actually being able to have it. There are also genes that are being tested for now. We have the BRCA1, BRCA2, and a few others that are being checked on now to ascertain whether people with that kind of gene would actually have breast cancer. And based on that, I know that there are people, certain popular artists that would know in the public domain that sometimes would even decide to take away the organ, the breast, because they have these genes so that they don't have breast cancer. It's absolutely fine to keep your breast, and it's fine to check whether you have these genes. I think it's important that we are able to inform the public, or we all know that the fact that your mother or somebody else has it doesn't necessarily mean that you would have it. It's important, like I've mentioned in my previous videos, to actually check and keep checking whether you have breast cancer. It's one of the ways of being able to catch it early. And I believe once you're able to do that, then you can get the right treatment that's associated with it. So the fourth myth was, one of my viewers asked me, so what if I live a healthy diet? I eat healthy, I exercise, I don't drink, would I get breast cancer? It was interesting, when I was asked that. And I think that it's important for us to all know that living healthy is important, is good. Being able to reduce obesity in our daily lives is very important. But however you look at it, breast cancer is not determining or it's not dependent on whether you eat healthy or you live a healthy life, or whether you maintain a healthy ways, or whether you don't drink. There are other factors that are related to it, and so it's important to keep checking and to find out whether your breast is developing any abnormal signs, whether you are having any discharge or anything. And you can refer to my previous video if you have any questions to do with the signs and symptoms. The fifth one was that, the antiperspirants that we use, the deodorant that we use, does it cause breast cancer? It's interesting. I don't know why somebody would think that, some of these things, maybe because it has alcohol, it has all the chemicals that they put in there. But it's important, again, to inform the public that there's a lot of research that has been done. I haven't cited any that has stated that any antiperspirants or any deodorant actually causes breast cancer. And based on that, we shouldn't put out that information. So you can go on and use the deodorants and everything else and know that it's not going to cause breast cancer. The sixth one, was wearing a bra. Does it cause breast cancer? No, it doesn't. Wearing a bra doesn't actually cause breast cancer. I think I've seen an article where somebody said that wearing a bra in the evening or morning or afternoon or in a dark area or in a sunny area could actually cause breast cancer. I don't think there's enough research to back that. So if anybody should put out that information, please tell them that you have to do more research into that, because wearing a bra doesn't actually cause breast cancer. The seventh one was putting a phone in your bra. Does it cause breast cancer? I don't know whether you've heard this before, but there are some older women sometimes that put, certain devices like their phones in their bra. And then you have people saying that because of all the electromagnetic waves and all the radiation that is possible, that you could have breast cancer. I think my advice professionally would be that try not to put devices like that around your body. And if you can avoid it, then you should. But we don't have any research currently that shows that putting your phone in your bra or any part of your body actually causes cancer. And I believe that once you have that information, you'll be empowered to make the right decisions. But keep the phones and other things like that away from your breast. The eighth one is sugar consumption. Does it cause breast cancer? Sugar, breast cancer. So sugar on its own can cause certain health issues. And sometimes it can cause obesity, which has been one of the factors, the risk factors that has been mentioned in breast cancer, in diabetes or in obesity. And I mean, that's also underlined for breast cancer. But there's no relationship between sugar and breast cancer. The fact that somebody who is obese is predisposed to having breast cancer doesn't mean that taking sugar can cause breast cancer. Sugar, if taken in moderation, is fine, and I think it's a sweet thing that can be added to our beverages and any other thing that we want to take, our breakfast and all of that. It should, however, be limited, because excess or abuse of sugar is not the right thing, if you ask me professionally. And I think that even apart from breast cancer, it comes with certain health issues, because abuse of it would cause certain organs to be overloaded, and I'm sure we'll discuss that in other videos. But to bust the bubble or the myth again, sugar doesn't cause breast cancer. And then the ninth one, annual mammogram, taking an x-ray of your breast. Would that be able to help you reduce your chances of getting breast cancer, or it will be able to help you get breast cancer? There's that debate that goes on sometimes. So like I have mentioned earlier, it's important to look at your breast every day, to examine it, to find out what exactly is going on. So you don't have to wait once a year to actually check through a mammogram to find out whether you have breast cancer or not. I don't think that's the appropriate thing to do. I think that every day, once you wake up, you need to find out how your breasts are doing, male or female, because like I mentioned, there's up to 1% of the population of men that do have breast cancer. So even as a man, you're supposed to check your breast to find out whether there are any secretions, any abnormalities, any signs, any growth, anything that you are not comfortable with. And if you are not, please get the attention of your healthcare practitioner, because it will go a long way to help you. Breast cancer. The 10th one, breast cancer. Does it cause a lump? Is it all the time that you see any lump in your breast that you think that you have breast cancer? I have to bust that myth, but it's also important to put it in context. So there are times when you have certain lumps that are false negatives. So that means that you don't have breast cancer. In the event that you have lumps that are abnormal, that are persistent over some days, I think it's important to discuss it with your healthcare practitioner so that we can be able to give you the needed attention as soon as possible. Some lumps are related to other things, I mean, hormonal changes and all of that. And we'll discuss into details how those lumps come up. But it's not every lump that means that you have breast cancer. And there are other signs that can actually show that you have breast cancer. It can be a sore, anything of that sort. It can be a growth or anything. And so anything you're not comfortable with when it comes to with your breast or any part of your body as such, you should actually contact your healthcare practitioner. The 11th one, early stage breast cancer that is cured or that has been resolved, would it reoccur? So it's important to note that in breast cancer or in cancer life, being able to live for 5 years is actually a huge milestone. And so if you've had breast cancer in the past, it's important to keep checking your breast every day, to examine it, find out how it's doing, to check for the lumps, the secretions, to check whether there's any irregularity, any blood discharge, or anything of that sort. And if you find anything of those things, please bring it to the attention of your healthcare practitioner. Being cured or having your breast cancer, let's say, being taken care of in the past, doesn't mean that you are free of not having breast cancer. It can reoccur depending on the type of breast cancer or how your genes are actually going to react to the whole cancer disease. So whatever the changes are at any point in time, don't take it for granted. Please bring it to your healthcare practitioner and then let us do something about it. The 12th one is breast cancer. Are they all the same? No, breast cancer, they are all not the same. There's so much that has to do with breast cancer. There is the early stage breast cancer where you have a little lump that can be taken out, and the earlier you come, the better. It's important to know that coming early saves lives. Then there's where it can spread a little. So we have ductal carcinoma in situ and the rest. And then there's the metastatic where it will probably spread to the other parts of the body, and then it becomes a bit difficult to actually manage it. At every point in time, you still need healthcare practitioners. You need to be referred from your pharmacist or your general practitioner or your nurse to somebody who is well advanced or specialized in managing breast cancer, and it can be your surgeon or your oncologist. It's important that you meet with your primary healthcare practitioner, discuss some of the changes you are seeing so that we can be able to refer you on time, and then you can get the necessary help that you deserve. So there are different types of breast cancer. There are different staging. There are different. It comes with different hormones that are either positive or that will react to it well, or that will be negative to it. And all of that would decide on, or would be able to inform the healthcare practitioner on what kind of therapy you can actually have with your breast cancer. So whatever cancer it is, whatever breast changes or breast cancer it is, there are certain procedures that are standardized. The biopsies, the test, and all of that will be done, and then the appropriate management will be given to you. So please come in early so that we can give in the help that you deserve. The 13th one is breast cancer. Does it affect only middle age and older women? As a young woman, I'm in my 20s. Do I need to worry about breast cancer? Breast cancer does affect people that are younger, men and women alike. And I believe at the time when I was engaging with the hospitals, there were times that we saw women in their 20s or even lesser than 20 actually having breast cancer. And some of these women luckily were able to check their own breast and come in early. And a lot of them are alive and fine and are doing very well. So there is hope when you have breast cancer. Please don't stay in the house. Breast cancer doesn't affect only older women or middle-aged women or women that are in a certain group. It can affect anybody. So it's important to actually get help, to check your breast every day and ensure that you get the help that you actually deserve. Then the 14th one. The 14th one is the treatment. When would the treatment be appropriate? When would it be finished when it comes to breast cancer? So yes, breast cancer treatments can be short depending on at what time you come in. So the myth, actually, the question that I was asked was, breast cancer treatment, is it a short one? Is it something that you go in and you are done, or is it something you have to take for the rest of your life? So all of that, like I've mentioned, depends on the type of breast cancer you have, whether it is hormone sensitive or hormone resistant. All of that would be able to let us know the kind of treatment or the kind of help we should give to you. So don't be worried. Check your breast regularly. Anything that's an abnormality in terms of the signs, any growth, any discharge, please let your primary healthcare practitioner, your doctors, your pharmacist, your nurse know about it. There are several facilities that actually check breast cancer, and especially in the month of October, you have a lot of it being free. So take the opportunity to get your breast examined, and I believe that it will go a long way to actually help you. And I mean, for whether you're a man or a woman, you're a support system for your family. And so it's important to come in early, get the help so that you can actually live long to support your family. It's stressful when a family member has cancer and it affects the whole family. And we need you alive. And that is why you're supposed to ensure that you come in early, get the best treatment so that you can do well. The final one is breast cancer a death sentence? No, breast cancer is not a death sentence. If you come in early, we can actually help you. Like I mentioned earlier, there are people that have lived for several years with breast cancer, and I believe that you also deserve that opportunity. So check your breast regularly, and then ensure that you get help as soon as possible when you find any abnormality. And remember that there's a lot of help out there. There are lots of healthcare practitioners out there that can help you. There are lots of medications out there that can be offered to you. Breast cancer is not a death sentence. Get help early so that you can live long to support everybody. And we'll be happy to see you every day or every year. So please subscribe if you haven't. Please like, please share, and please tell others about our channel. We are growing together, and I'm happy to have you here. Thank you so much. And please tell me what you want to hear about so we can discuss it. Thank you so much.